majorly WhatsApp. There are these messages of people begging for assistance, for financial assistance due to health issues, ranging from heart issues, heart diseases, to renal transplant, to brain surgeries. Some people wake up in the morning and the next thing their legs are already swollen, and it gets worse, and worse every day. At the end of the day, they need money to get those kind of things off themselves and be healthy. You see some people, cancer of the breast, cancer of the skin, cancer of the liver. Some people, a lot of kidney issues, a lot of chronic and acute diseases that a normal person, an average person, cannot cater for himself. And you look at the state of things and you ask yourself, this can be me. It's another person today. It can be someone close to you, or even you, because those who it happens to didn't wake up, didn't pray for that. You see some people, they just wake up in the morning and their stomach starts swelling up. They need money for surgery. Some people just wake up in the morning and they can't urinate. Some people will just have their mouth start swelling up. Before you know it, it affects the neck. Everything starts swelling. They need money. What? They need money to cure them. At the end of the day, they start to plead for money, for assistance on social media platforms. This is not my issue. My issue is not only about the money, but my issue is also goes to the pain they go through while they try to fix all these things. Now let's go to the state of Nigeria and the state of healthcare in Nigeria. Join me as I discuss about the state of healthcare in Nigeria. The record straight. We have a total of 54 federal government hospitals in the whole of Nigeria. The best among them we know definitely is the UCH, that is the University College Hospitals. We have a total of 22 University College Hospitals in Nigeria. We have a total of 20 FMC, that is Federal Medical Centers in Nigeria. We have the National Eye Center, that is only one. We have 3 orthopedic hospitals, and we have 7 psychiatric hospitals, making a total of 54 for the whole of Nigeria, where we have a population more than 200 million Nigerians. Let me tell you something that you people don't know. Those that are rich will actually go outside the country to treat mere headache, but it is the poor who are suffering. And the funniest thing is that most of these facilities that are not even enough, most of them are in the urban areas, and it deprives the people in the rural areas the opportunity to benefit from this. Let's look at Ghana, for example. Do you know the population of Ghana? We used to make mockery of Ghana not being to be as small as Lagos State. Ghana as a whole has 897 government hospitals in Ghana. And Nigeria have a total of 950 government hospitals. 950 government hospitals, while Ghana, who is just like Lagos State, has a total of 897, very close to that of Nigeria. And you wonder what our government is actually doing to take care of the health of its citizens. Healthcare sector is underdeveloped, grossly underdeveloped, and does not meet local needs. Looking at the statistics that have been given now, a whole Nigeria having a total government hospitals of 950, and Ghana has 897, which is just like 53. I think that's 53 more than that of Ghana. And look at the population of Nigeria and that of Ghana. Just this year, the original agreement of the budget for healthcare sector was supposed to be around 50% of the total budget, but it was reduced grossly. It was reduced to 8%. And do you know the funniest thing? Even at this 8%, this was again reduced to what? By 50%. Initially, it was supposed to be 44.4 billion, which was not actually the first amount. The first amount was around 8 to 9 billion. They reduced it. The agreed amount was around 88 to 9 billion. They reduced it to 44 billion and again cut it by almost 50%, which later came down to 25.5 billion. And when you look at this figure to the Nigerian population, it means that they plan to give each person 2,000 naira to cater for the health of each citizen at the rate of 2,000 naira per citizen for a whole year. And you ask the question, are they really bothered about our health? These people that are dying from these chronic diseases, it is the responsibility of the government to cater for this. All those things are supposed to be done free of charge. But when we speak and when we try to let the government know that what this thing they are doing isn't good, some people will look at it from the angle of politics. It's not about politics, it's about the life of everyone in this country. The government needs to stand on its responsibility to make sure that everyone gets adequate health care. whether in the rural area or in the urban area. Just look at it. Nigeria healthcare is not even capable to cater for its growing population. We are growing every single day, and our budget for the healthcare is not even increasing, it's even dropping. They are more concerned about that which will give them income. They are not concerned about the health and the amount they lose when they don't provide solutions to the healthcare sector. Look at those that are dying every day because of one disease or the other. Like I mentioned in the beginning of my discussion, you see them, they are dying. Those people that are dying are not supposed to die if they do the right thing, because it's the responsibility of the government to cater for them. They are not normal diseases. That is not malaria, that is not fever, that is not typhoid. Those are chronic sudden diseases that could happen to anybody, and it's the government that should provide profound solution to these things. But they are not being done. Instead, we come up and jubilate for little things that doesn't even count. Little things that are the normal things that they should do, we celebrate. Why those that are supposed to do, we don't come out to speak against it. The health and safety of everyone, the citizens, is a basic responsibility of every government. And when this is not done, then we need to now know that even we are not safe. Like I tell you, it can happen to anybody. It can be me today, it can be you tomorrow. You can wake up tomorrow and you just find something abnormal happening to you. And at the end of the day, they'll tell you that you need to go to UCH. At the end of the day, they start contributing money for you. Those things that they contribute money for are actually the things that the government are supposed to cater for. Now, ask yourself, they received a lot of donations. Donations that they received. At least this is the time for them to use to improve on the healthcare sector. The money that, who is accountable for those money? Is there any accountability for this money? No. Health and safety goes together. Some people would be asking me, does it concern me? Am I a health person? I said no. One, I'm a citizen of Nigeria and it concerns me. Number two, I'm a health and safety professional. The life of everybody is important to me, and anything that we can do to prevent the increases of death from these chronic diseases should be done. There need to be enlightenment. There are some things that might have caused this thing. The government needs to go into it because I believe that because it's not happening to them, because it's not happening, and if it happens to them, they know how to cater for it. Someone who just woke up and started having feeling of teeth, then started getting swelling up. At the end of the day, the person died from that. Or someone whose leg started swelling up, or someone who could not urinate again, or someone who just studied chronic acute diseases that you don't even expect. These are the things that the government needs to cater for. You are supporting the government, why they're not doing the right thing. It can happen to you one day, and it's the government that's supposed to take care of you if it happens to you. Let us wake up and let us call the government to ensure the health and safety of everyone in this country. It is very bad and we need to talk. And that's what I'm going to discuss today on my episode of Safety Mental Aliola. It's supposed to be safe. The country is supposed to be safe for everyone to live in. Thank you, and join me next time.